So we're here for the next installment of Rare Talks, where we're going to be chatting to Eddison and Richard. Thank you guys for joining us about living with, now I hope I pronounce this correctly, Xeroderma pigmentosum, or XP for short, and seeing the difference of living with the disease from two people at different life stages. So if you don't know what Rare Talks is, Esther and I have EDS, or Ehlers-Danlos syndrome, and started the Rare Talks series to talk about growing up and sort of like the daily struggles of living with rare disease, like I said, sort of from two different life stages and ages. So I don't know if Esther wants to say a bit about herself.
Yes, I'm 12. I'm Esther. And yeah, I have EDS, like Katie said, and a couple other things.
Yeah, so again, I'm Katie. I'm 19 and I also have EDS.
Okay. Hi, I am Edison. I am 10 years old and I have XP for short, and the long version of it is Xeroderma pigmentosum.
Yep, so similarly, my name is Richard. I'm a person with Xeroderma pigmentosum. I'm 31, so a bit further along than Eddison. There's, without going into the science too much, there's eight different types, and me and Eddison have got slightly different ones.
Yeah.
So how does XP affect your daily life?
XP affects my daily life because, basically, I have to make sure I put my cream on in the correct places, normally face, legs, hands and arms, neck and ears, obviously. And then I've got to put my gloves, buff and hat on, which is also a really great hassle to my life. But after you've got it on, it doesn't really bother you that much.
So similar to Eddison, so the cornerstone of having Xeroderma is photosensitivity, or sensitivity to ultraviolet light, or the light that gives you a suntan. So it's often there when you've got visible light. So anytime during the day, you're exposed to that, and it means protecting yourself. Some people protect themselves more, some people less. Me and Eddison are at the more protected end of the spectrum, and this is the kind of hats we wear. So it's kind of like most people think it is a COVID hat, but it's not. We were there years before COVID.
Yeah.
And I would add to Edison's bit that it's a lot about planning. So yes, there are all those practical elements, but there's a lot about where you're going to be later in that day. Is it safe? You're going to have to be outside.
Stuff you can do with it on, if you think about it. There's a lot of stuff you can do. Yeah.
Yeah, and then also where you're going to be. So is the windows going to be safe? Is there window film on the where you're going to be? How are you going to get there? What facilities are going to be there? So lots of planning that perhaps there's lots of planning as well, basically. So that's how it affects day to day, the practicality of it.
But yeah, definitely. And what do you think both of you are the biggest challenges of living with XP?
I think that the greatest challenges of living with XP is, yet again, putting all your cream on and putting your gloves and your protection on. I think that's just a hassle. But like making sure everything's safe, everyone knows about the conditions, so no one opens any doors and windows, and everything's protected for you, because you never know what could happen. It could just be that window that's open that could affect you, or that door that's open, and then that one person that doesn't know that opens the window because it's a little bit hot in the room. That's just a big challenge to let everybody in that, for example, school or college, to tell them that that is the thing that you have, that you can't have that thing or door open.
Yeah, I totally agree with that. And that's the only thing I'd add to that is that perhaps what you perceive to be the biggest challenge perhaps changes for me at different stages. So when I was your age, Edison, that was certainly the thing at the front of my mind. And then as I got a bit older, it changed to, what's going to happen at work, what's going to happen when I'm studying, what's going to happen with these different people. And I'm sure, like Katie and Esther, there's a large challenge in trying to explain to people what it is that you have and why it is that you do what you do. And XP, it's perhaps a little bit more visual than some other conditions when you're all geared up, but you still enter in the same conversations as I'm sure you two do with explaining why it is you're doing what.
Yeah, definitely. There's a lot of people trying to get people to understand, and obviously for you two as well, putting the precautions in. so it doesn't harm you. And there's like a lot of communicating and hoping that people will understand, because sometimes they don't as well.
How does XP affect your family?
Well, for my brother, especially, that he can't just say, let's go out and let's go outside, and we can just be out there immediately. I've got to do the different stages. It will take me a while to be able to do something that is a little bit harder maybe for my brother, because for example, he could be like, let's really go, I really want to go outside, and then I'm trying to put my stuff on because I don't want to make him unhappy because he can't go outside fast enough. So it's also that hurry of trying to get ready so you can make everyone else happy but yourself as well.
Yeah, I feel like I'm just echoing all of Edison's points, but yeah, more or less. In so I can kind of look back now at that stage, and perhaps it had more of an impact on my sisters and my mum than I appreciated at the time. Because at the time, you're just there, you see what you can do, what you can't do, and you know, I've got two sisters, so my sisters and my mum and dad would automatically make it okay for me, or however it was going to be. But looking back, it certainly affects them more than I probably gave them credit for. And even now, you know, my two sisters, they don't go out in the sun. My mum and dad don't sit out in the sun. They don't, even if I'm not there, they don't go on sunny holidays and things. But and I think it's just worth bearing in mind here that so me and Edison are focusing quite a bit on the photoprotective aspects of XP, and there are other elements to the condition which other patients have to contend with. So things like mobility, or well, things to do with other parts outside of the skin. So there's other things to consider as well.
What was it like going to university and working whilst managing XP?
Yeah, so I feel like I'm giving you very generic answers here, but I would assume it's very similar to yourself and Esther, or in a few years' time for Esther, whereby it's just about being as open as you can be with whoever is the powers that be. So for example, I used to work I've had lots of jobs. One of the jobs that comes to mind before my current job was working in a chip shop. So I would always work in the back, and he had, I was safe there. I just said what I could do, what I couldn't do, and then I'd work in the rest of the shop in the evening. And I think it's just about setting your expectations. It's been a bit more difficult as I've got older in some other workplaces when I've worked in bigger institutions. So at the moment, I'm a doctor, so a skin doctor, a dermatologist, and when you go through different hospitals, it can be a bit challenging because the hospitals sometimes have different management structures. So you have to liaise with lots of different people, and sometimes in the NHS things don't happen as quick as you want it to be, and you have to kind of keep nudging. But I think it's about being very firm and setting what it is you feel comfortable with and what it is that you don't feel comfortable with. And there are lots of people I would imagine that have XP that are comfortable with much less stringent protection than me and Edison practice. And to be honest, I would imagine it's the same for you, Katie. Like you say, you know, like it's about telling who you work with or who you're studying with what it is you're capable of and what it is that you find more challenging.
Definitely, it's communicating with everyone at university or work and making sure they're aware of the situation and sort of like rely on knowing what your limits are and what you can and can't do. But actually, I'm going to throw in another quick question there just because I think it might be quite interesting. But did your condition influence you into like becoming a doctor and a dermatologist and everything?
Yeah, absolutely. Who knows what other boring specialty I'd have ended up in? Like could have been a rheumatologist, you know. Yeah, certainly, because we've been around doctors since I was diagnosed when I was 8 years old, and since then I gave a talk about a month ago to the doctor that used to look after me actually, and of course, and it was the first time I'd been back there as a dermatologist, so that was kind of nice. And she's a professor now, the one that used to look after me in Birmingham, Professor Moss. So that was good. But yeah, certainly that without XP, I wouldn't have gone into medicine.
Definitely.
So Edison, for you, how does XP affect your school life?
This is probably a myriad answer that I've already done, but making sure that everyone knows about your condition, no open windows, no open doors, making sure everyone can support you. If you feel like someone is doing something that you feel like they're just bullying you for, because they know you have it, but they're doing it to make you annoyed at them and make you feel worried about something. So it's really just the fact that you want to have people that stick up for you if you're in that place when someone's trying to bully you about it.
Yeah. Actually, is it okay if I also just add another question?
Yeah.
How do you deal with the bullying and like the aspect of making friends?
I mean, making friends part isn't really the problem, but the part that's like, I also don't really get bullied as often as people might think, but I have some actually quite nice people in my class, and even they know that there'll be, for example, a punishment if they do something that will make me feel harmed. So, yeah.
Sounds like you're a bit cooler than I was at that age, Edison. Like my youngest, well, both sisters, but my youngest sister in particular, she'd stepped in on my behalf more than once, and I remember very vividly she smacked someone in the throat for me who had pinched my hat. She was taking none of it, and I'm more of a let's talk about it, explain kind of person. She just took action, so it really rated her for, but not so much my way of dealing with things.
And following that, how does wearing the visor and all the equipment affect your friendships and socializing and like communication with others?
Really, to me, the friendships part is just like the fact that you can't really like hug them as close as you would normally. But it's the fact that like making friends is like the easier part to it. It's like the other parts for like having the other things that you would with a friendship, because like, for example, if you went to have a huddle to talk about something, my cat would always hit someone in the head and they're always like, why did you do that? And I'm like, it's not my fault, because it's just like, because it sticks away from your head, you can't really help if someone's a little bit, if you're too close to someone, then it just accidentally bashes them. So also it's a fact of like repeating what you've said before, and you have to keep repeating it until they hear it. But like, for example, if it's like a really windy day, you'd have to repeat it like 3 or 4 times, and it's just so annoying having to repeat everything that you've said. It's also really annoying that people just put their face so close to you so they can hear you, and it's not very nice.
So again, I'd say something a bit different here. Like maybe you were more friendly than I am, or was, but I've never been a hugging type of person. One of my friends was criticized me a lot last week actually for how bad I am at hugging people, like physically poor at hugging people. So it was never such a problem for me. But what I would say about all that is especially with COVID, the amount of what's it called? The amount of identity that you attach to someone's face without realizing it. And so, for example, you might have realized, when people are wearing the face, what are they called? The little blue things. Yeah, the face mask. And they'll take them off, and you realize actually the lower part of their face actually adds quite a bit to their appearance and their identity. So if you translate that to wearing the visor, and I wear a scarf under mine and these big sunglasses, so you can't even see any of my face, and that's a big deal for some people, because as well, a lot of people they think it's quite threatening, and that's it's a bit less so as an adult. Like, I'm not so worried now. If sometimes feel guilty if people feel intimidated, but I'm not dangerous.
I could also relate to some people thinking it's a bit intimidating part, because whenever I'm in transport, I have to wear a neck brace, and some people I think are a little scared of it in some ways. Especially kids. People
because they think you're what?
Yeah.
Why do you think that? What makes you think that, or say that?
Just the way that they react, sort of, when they see me. Mainly,
I think it's like when they're young, they're more curious, aren't they? They haven't they're not as used.
Also, some adults still react that way, but yeah, you gotta just live with it, really. So are there any positives to XP?
Pardon?
Go on,
Are
Edison.
there any positives to XP?
I think the positive to XP is I just feel really unique in so many different ways. And that's really all I can say for that one.
Yeah, that's a good point. Just to go back to what Esther was saying before about people staring and being, you know, a bit rude and whatnot. Like that's something that still, I mean, that will continue, won't it, if you've got to wear your gear. Same for us. The thing I kind of realized, especially in the past few years, is that even if you weren't wearing all this gear, people stare. It's part of it's natural. Some people stare too long, fine, but it is very much a human trait to stare at things that we don't understand. Even things we do understand. You just have a good old stare, and there's some people that say things in a way that's more sensitive than others, which obviously is better. But I don't criticize people now so much for what they say. I mean, obviously some people are not well informed and they don't say it in the right way, but I don't get as angry now as I did with people who ask questions.
So for the last question, what advice would you give to other young people living with XP or another rare disease?
I've got to say, just push your limits, enjoy your life because you only have one chance. Just make the most of your life yet again because you only have one chance at life.
I think that's good advice for all of us, isn't it? I totally agree. And there's always a way to do something, or to work out a way to do something, or most of the time there is, I would argue. So it shouldn't, having a chronic condition, by and large, shouldn't get in the way of. Not sound too defeatist. Obviously, there's going to be exceptions, but try and work around it rather than letting it consume you. Would be my take-home point.
Definitely, yeah. And I was thinking, if I were to answer this, to be honest, that was exactly the answer I was going to give as well. Don't let your rare disease stop you from doing what you want. Obviously, like you said, there are exceptions, but a lot of the time there's ways you can adapt or learn around it. And I don't know if Esther wanted to add on any advice you might have.
Yeah, mine's just sort of the same. Don't let it stop you from doing what you want to do. There's always ways that you can work around things.
I think that's good advice. Also, it's great that you two are doing this. And all three of you, you're doing this at a much younger age than I ever engaged with all these kind of things. So I think that's really important to bear in mind on your part. So I think that's great. Well
Thank you. Yes. So thank you, Eddison and Richard, for joining us. I hope whoever was watching it helped you learn a bit more about XP and growing up with it. And hopefully there'll be more Rare Talk videos soon.
Make sure you go to teddingtontrust.com.
So Teddington Trust is one of the main XP charities, online presence, and lots of information to learn more. And you can always get in touch with myself or Richard Barley or Eddison or Nicola Miller. We've got our website. You can contact you there, even if it's just about more information or anything at all, fundraising or absolutely anything. You're always welcome to get in touch.
And if you want more information about Rare Revolution and the Rare Youth team, you can check out our Instagram and website, which